Good afternoon. This is Fadela Shaib speaking to you from WHO headquarters in Geneva and welcoming you to our global COVID-19 and other health issues press conference today, Thursday, 6 April. First of all, I would like to apologize for the delay in starting this press conference. Today's press conference is hybrid. We have the pleasure to welcoming in the room journalists based here in Geneva, and we welcome also journalists joining remotely. Today's press conference is on the global health issues, but also on a very special occasion. It's World Health Day and the 75th WHO anniversary, which we will be celebrating tomorrow, 7th April. Let me introduce to you the participant in the room first. We have Dr. Tedros Adhanom Ghebreyesus, WHO Director General. On his right is Dr. Katarina Boime, Chef de Cabinet, and Dr. Maria Nera, Assistant Director General ad interim, Universal Health Coverage, Healthier Population. Dr. John Reeder, Chief Scientist ad interim. And on the other side, and we have also, of course, Dr. Hanan Belkhi, Assistant Director General, Antimicrobial Resistance, and Assistant Director General ad interim, Access to Medicines and Health Products. On the other side, we have Dr. Maria von Kerkhove, who is the technical lead on COVID-19, and we have Dr. Samira Asma, Assistant Director General Data Analytics and Delivery, and beside her, Dr. Anshu Banerjee, Assistant Director General ad interim, Universal Health Coverage Life Course, and we have also Dr. Teresa Kasaeva, Assistant Director General ad interim, Universal Health Coverage Communicable and non-communicable disease. We have several other colleagues and senior managers online, and we will call on them if we have questions for them. We have translation in the 6 UN languages plus Portuguese and Hindi. As usual, we will start with opening remarks from Dr. Tedros, and then we will take your question. Welcome all. Over to you, Dr. Tedros.
Thank you, Fadila. Good morning, good afternoon, and good evening. And I would like to welcome all our Geneva-based members of the press to our compound here, and I'm glad we met today. We're meeting today in person. Once upon a time, the nations of the world had a vision. After years of war, they realized that it was better to work with each other than fight with each other. They realized that a healthier world was a safer world. Their vision was clear, but bold: the highest possible standard of health for all people. To achieve that vision, they agreed to set up a new organization. They debated and agreed what this organization would be and do in a document called the Constitution of the World Health Organization. Tomorrow marks the 75th anniversary of the day that Constitution came into force. It was and is a landmark document. The WHO Constitution was the first document in history to formally recognize health as a human right. Since then, the world has made significant progress towards realizing that vision. Life expectancy globally for both sexes has increased from 46 to 73 years, with the biggest gains in the poorest countries. Smallpox has been eradicated, and polio is on the brink. These are actually two of the important highlights during the 75 years of existence of the organization. 42 countries have eliminated malaria. The epidemics of HIV and TB have been pushed back. 47 countries have eliminated at least one neglected tropical disease. In the past 20 years alone, smoking has fallen by a third. Maternal mortality has fallen by a third, and child mortality has halved. Just in the past 5 years, new vaccines for Ebola and malaria have been developed and licensed. And for the past 3 years, WHO has coordinated the global response to the COVID-19 pandemic, the most severe health crisis in a century. We cannot claim sole credit for these achievements, but we have played a leading role in all of them, partnering with many partners, especially with our member states. And although we have many achievements of which to be proud, we still face many challenges, some old, some new. Around the world, people still face vast disparities in access to health services between and within countries and communities. Since 2000, access to essential services has increased significantly, but at least half the world's population still lacks access to one or more services like family planning, basic sanitation, or access to a health worker. Often, this is because of where people live, their gender, their age, or who they are. People living in poverty, refugees and migrants, people with disabilities, ethnic minorities, and other marginalized groups. Meanwhile, since 2000, the number of people who experience financial hardship from out-of-pocket health spending has increased by a third to almost 2 billion. Non-communicable diseases now account for more than 70% of all deaths globally. Rates of diabetes and obesity have increased dramatically, driven by unhealthy diets and physical inactivity. Progress against malaria and TB has stalled. Antimicrobial resistance threatens to unwind a century of medical progress. Air pollution and climate change are jeopardizing the very habitability of our planet. And as COVID-19 has exposed so brutally, there remain serious gaps in the world's defenses against epidemics and pandemics. For all these reasons and more, the world needs WHO now more than ever. Two meetings in Geneva this week highlight the challenges we face and the work we're doing with our member states to address them. The first is a meeting of the International Negotiating Body, which is discussing the zero draft of the Pandemic Accord. Like the WHO Constitution itself, the Accord is a generational commitment to face shared threats with a shared response. No nation can protect itself against future epidemics and pandemics without the engagement and cooperation of all nations. Over the next year, countries will continue to negotiate the accord in preparation for the World Health Assembly in 2024, where it will be presented for adoption. The second meeting being held this week is the 5th Global Forum on Human Resources for Health. Health workers are the backbone of every health system. Put simply, there is no health without health and care workers. And yet, many countries face severe shortages of health and care workers, and many of those they have migrated to other countries for better pay and conditions. WHO estimates that on current trends, the world will face a shortage of 10 million health and care workers by 2030, with the most acute shortages in the poorest countries. The COVID-19 pandemic has reminded the world of the immense value of health and care workers. And yet, an estimated 50% of health and care workers experienced burnout during the pandemic. Even before COVID-19, many health and care workers worked in unsafe conditions with low pay and inadequate training. And although women account for almost 7 in 10 health workers globally, they hold less than 1 in 4 senior jobs in the health sector. Many female health workers also face gender-based violence in the workplace. As the world rebuilds from the pandemic, we're calling on all countries to protect and invest in their health and care workforce with safe working conditions, decent pay, protection of labor rights, and protection from violence and discrimination. Alongside the Global Forum on Human Resources for Health, WHO also today launched a new campaign to improve emergency care training for nurses and midwives. Nurses and midwives play a key role in emergency situations. When emergency care is delivered well, the chance of surviving an injury or life-threatening illness increases dramatically, while the risk of a long-term disability is significantly reduced. To provide high-quality emergency care, nurses and midwives require high-quality education and training. Our new campaign is called 25 by 25 by 25. Our goal is to support 25 countries to train 25% of their nurses and midwives in WHO's basic emergency care course by the end of 2025. Finally, this year marks the 4th edition of the WHO Health for All Film Festival. This year, nearly 800 filmmakers from 106 countries submitted short films in 6 categories on themes including the health impacts of climate crisis, COVID-19, mental health, malaria, disability, and more. 90 films have been chosen for the shortlist for review by a jury of international artists and development leaders. The winners will be announced in June 2023. The shortlisted films are available on WHO's YouTube channel in 6 playlists, 1 for each of the competition categories. We encourage everyone to watch the films, make comments, and share those they like most on social media. Film is a powerful way to tell stories about health. WHO's own story began 75 years ago and is still being written. Challenges we face today are very different to those in 1948, but our vision remains unchanged: the highest possible standard of health for all people. Fadila, back to you.
Thank you, Dr. Tedros. We will open the floor to questions. We will start with journalists who are here with us in the room. Isabelle Effet.
Thank you very much. I would like to that if you can comment on the outbreaks of cholera in several countries in Africa. And also I read that there are some analyses that says that the most many of the countries affected shows also a disproportionate situation of gender inequality. What makes that victims, persons infected, are mostly women and children. If you can comment that, please. Thank you.
Yes. Thank you, Isabel. I would like to invite Dr. Abdelrahman Mahamoud, who is the director at NTM for the Alert and Response Coordination, to take this question. Dr. Abdi, can you hear me?
Thank you, Fadila, and thank you so much for highlighting cholera, one of the neglected pandemic lasted within the history of WHO as we celebrate 75 years. Indeed, has been a major issue as the climate conflict and humanitarian crisis coming together, a disease that we are seeing is spreading further. We had a big outbreak in Malawi, now in Mozambique, spreading further into southern part of Africa and a lot of countries. As DG several times have said, we require this impact disease being turbocharged because of the climate crisis. Of course, climate crisis and a lot of the burden of this falls on the gender issue. Women and children have been affected more and more cases we have been seeing. Our team there, with the support of social anthropologists, are engaging with the communities, understanding disaggregated data and the burden on gender and female. So thank you for the highlighting that point, and thank you for starting with cholera, the longest pandemic we've been struggling with.
Thank you, Dr. Abdi. Let's go to Jeremy Lange from Radio France Internationale.
Thank you. Good morning, good afternoon, maybe. I'd like to go back to the pandemic treaty. I'd just like to know, how are the talks going? Is it more like a stalemate for now, or do you expect members to move along the line between the need for more transparency versus status quo? And I believe the line will be more China against the US. So how is your feeling right now about the talks and the week that we've been through?
Anyone online from colleagues, or I go? Yeah, maybe to talk about what's happening this week, it's better to really recap the journey of the pandemic accord or treaties development until now. I think the first step, which was a milestone, was the agreement of the member states to have a legally binding agreement, which is very crucial. And second, they have opened up a very open, transparent, and inclusive process, and many stakeholders have already contributed, and that's why the zero draft is very rich. So I think these are very important developments. And this, as you know, is the IMB 5, and the commitment of member states is very, very good so far, because things are now going based on the plan. Of course, during negotiation, as you know, coming to this week, there will be differences. That's why there is a need for negotiation. And I know there are some sticky issues. And some member states even came and asked me about my opinion, even on some of the specific issues that's causing some differences. And my advice was, you know, this pandemic has been unprecedented. And we all have learned our lessons. But if we're serious about the lessons we have learned, then we will agree to put solutions to address the problems we have faced, so that we will not be confronted in the future with the same mistake. So to those who have asked me, that's the general answer I gave. Let's not allow ourselves to repeat the same mistakes again, because I don't think we will forgive ourselves if we don't include, or if we don't agree on this pandemic accord and repeat the same mistakes when another pandemic hits. And our children and grandchildren will also not forgive us. I think there is that understanding, the need for a pandemic accord. And the pandemic accord that helps us not to repeat the same mistakes, to address the problems that we have faced. I believe, although there are still controversial issues, which is natural, by the way, during negotiation, that's why they do negotiations, because there are differences, but I believe at the end of the day, they will find a balancing act. They will find a way to really come to a consensus to have the pandemic accord, because everybody knows this has been the most serious crisis in a century, unprecedented, and we have learned our lessons, and I believe everybody will understand the need to have an accord that addresses the problems that we have faced. So that's what I see. And this week there are areas where progress has been made, and there are areas that need continued engagement and negotiation. But in general, I think there is readiness by the member states. There is no difference actually on the need to have an accord. And on the content, at the end of the day, I believe they will come to a balancing act that will address the important issues and make this document as good as possible.
Thank you, Dr. Tedros. I would like now to go to the other side of the room. Tomo Deguchi, you have the floor. Yeah. Yes. Bruce? Let's take the question from Tomo, and then I will come back to Bruce.
Hi. Good afternoon. Tomohiro Deguchi with Kyodo News. China CDC have just published yesterday published the result on the papers about the Wuhan market, which contains the data which was not made open until this year. Could you tell us about your assessment on the result, and are we closer to the finding out the origin of the virus? Thank you.
So thank you very much for the question. So indeed, you're correct. The full paper was published yesterday, which is an evaluation of some environmental samples that were collected in the Huanan market in Wuhan in January 2020. That paper was actually made available last year as a preprint, as you know. It wasn't published in a peer-reviewed journal, but it was put up on a preprint server. So we did get a preview of what that analysis entailed. The researchers from China CDC have updated that analysis and have made the preprint available, and that paper is now published. The data that underlies that assessment has been made available to all GISAID users, and a number of scientists have downloaded that and now continue to download that analysis. What we've done as the World Health Organization is that we brought researchers together to discuss the data itself and the analysis that have been done with that data. And different groups are using different methods to assess this. What we understand from the analyses is that there is, from that data and from the analyses stemming from it, there's molecular evidence of animals that were sold in the Huanan market. Now, this was suspected, but we didn't have evidence of this. So we have molecular evidence that animals were sold at the Huanan market. We also know that within the samples that tested positive for SARS-CoV-2, there was evidence of DNA from animals. And some of those animals are known to be susceptible to SARS-CoV-2 infection. So these are clues, and these are clues that we use to better understand the potential exposures to humans in terms of how they may have been infected early on in the pandemic. It doesn't give us any concrete answers or answer all of the questions, but it does give us some clues in terms of what the intermediate hosts may be, and potentially how important, and we knew the Huanan market was an amplifying event, but we don't know if that was the exact start of this pandemic. Further information that we need, and we have been requesting for years now, is where did those animals come from? Where were they farmed? How did they enter into the market? Was this wild animals, domestic animals? How were they traded? Where did they come from? Where were they tested? Were the individuals who worked in the market were there serologic tests that were done from people who are working in the market, who are working on the farms? We don't have any of those answers. And so what we're trying to do is work with scientists to learn more information about the earliest cases of COVID-19 that occurred in November, perhaps even earlier than that. What were their occupations? Where did they work? So this gives us more clues, but it doesn't answer all of the questions. And so at the present time, we still have all of the hypotheses still on the table. You hear us say that a lot. And the reason for that is we don't have the data to take any of them off. But it does give us more information about potential intermediate hosts, and this is encouraged. I do, while I have the floor, say there's more information that's out there. We know there's more information that's out there, and we need scientists, public health professionals, governments to share this information. This is not a game, and I know every single one of you in this room knows this, every single one of you online, every single one of us sitting here. We need answers to understand how this pandemic began, because we will get better at preventing the next one. We can't just say better surveillance. We can't just say work with the animal and the animal-human interface. We need to know each of those factors that led to the emergence of this, whether it was from a zoonotic event or whether there was a breach in biosafety or biosecurity. This is going to happen again. And we need to understand the incentives and disincentives for surveillance, for reporting, for transparency, and this needs to be followed through. So as an organization, with our scientific advisory group for the study of novel pathogens, the origins of novel pathogens, or SAGO, we will work to ensure that this discussion remains scientific. We will work with all governments, all research institutions to pull the data together and have a scientific discussion to answer these questions. We haven't stopped that work, and we won't stop that work until we get closer to those answers or get those answers.
Thank you so much. Let's go to journalists who are waiting online. I am calling on Helen Branswell from Stats. Helen, can you hear me?
Thank you, Fadela, and happy 75th. My question is regarding the Marburg outbreak in Equatorial Guinea. Any information on updated numbers would be good. And also, has the country agreed to conduct, allow clinical trials to be conducted, or has it said no? Thank you.
Thank you, Helen. Dr. Abdi?
Thanks, Helen. In terms of the EPI, as you can imagine, these are evolving epidemiology, and with time we may have new cases, but as of now, we have 14 confirmed cases and 23 probable cases. Of course, with data investigation, the number may be shifting back and forth. What's good is the number of the system built over the last few weeks. The contact tracing has really gone up, almost 555 contacts are been followed, and follow rates around 90%. The country is still struggling with alerts. The alerts around 2 to 6, where we expected a double-digit number. In terms of research, as you can imagine, at the highest level of the organization, from Director General to the Regional Director to our representative, have been engaging with senior government at all levels since they start, as we believe very importantly what we learned from the past outbreak, integrating research is very critical. As for now, the country is really looking into that. They're considering the status of various elements, building the basic of contact tracing, alert laboratory. And what we are told right now is when the conditions may be favorable, the trials may be initiated. And so right now it's building the basic of good alert management and case management and other basics of the outbreak response. And at a further future date may be considered, but as of now, we don't have a firm date when it will start. But the government gave us on Monday the good news that WHO expert can receive visa on arrival. So we are getting more positive engagement from the government. And if the basic element of the response is well established, we believe that the government may consider this favorable. But as of now, we don't have a firm date when we can start. From WHO side, as we said in last week and the previous, we are ready, and we appreciate all the partners and all the government and all the stakeholders who have been patiently waiting when this trial will begin.
Thank you, Dr. Abdi. We will take another journalist online, Paul Adepoju from DEVEX, and we will come back to the room. Paul, can you hear me?
Yes, I can hear you. Thank you very much for taking my question. On July 23rd last year, Dr. Tedros officially declared Mpox a public health emergency of international concern. But nearly 1 year later, promises regarding making vaccine doses available in African countries remained unmet. So, and we are told that we are finding out that there have been some challenges regarding getting these vaccines on the continent. So I'd like to know the current situation of Mpox vaccine access in Africa. What are issues being delaying these vaccine availability on the continent? Thank you very much.
Thank you, Paul. I believe Dr. Rosamund Lewis is online. Dr. Lewis, did you hear the question?
Yes, thank you very much. I believe the question was about the availability of vaccines for Mpox in the African setting. So my understanding at the present time is that countries are requesting some vaccine supplies, primarily through bilateral contributions from other member states. And there are different mechanisms underway. So there are studies that are being proposed and designed. That is one example. For the Democratic Republic of the Congo is working with our R&D Blueprint team and government of Japan to design a randomized controlled trial for the use of their vaccine in that setting. And other mechanisms are underway through bilateral donations with other member states. There is no procurement of Mpox vaccine through WHO or other UN entities at the moment because we don't have a pre-qualified or emergency use listed product, but work is ongoing for regulatory review of these products, and that work is ongoing also with our Department of Medical Health Products and pre-qualification. So there are different streams of work that are continuing, and countries that are looking for vaccine. I believe there is also a donation being coordinated through the Africa CDC. So there are different mechanisms that countries can access, but at the moment there's not direct procurement through WHO. Thank you.
Thanks so much, Dr. Lewis. I would like to give the floor to Priti Patnaik from Geneva Health Files. Priti, you have the floor.
Good afternoon. Thanks so much for taking my question. This is for Dr. Tedros. You've acknowledged the timeline for these ongoing negotiations. Do you think that countries should buy more time to extend the negotiations, both on the accord and on the amendments to the IHR? And finally, this has been a member state-driven organization for 75 years. What do you think are some of the threats to this model of governance going forward? Thanks.
Thank you, Priti.
Yeah, thank you. Starting from the second one, the model of governance, there is no change. It's the same. Because of the pandemic treaty, there is nothing that will change. As you know, we have, like the FCTC, for instance, the convention, which is accommodated actually within WHO. So with the same, could be the same arrangement or different, but I don't think the main core governance structure of the organization will be different because of the pandemic treaty. Then on whether more time is needed, I said last week, you're right, that we're really pressed for time now, and the 1 year left is very tight. So it's only 1 year left now. From this May 2023 up to May 2024. So it could be tight, but I also believe that it doesn't need any extension. I believe that it should be finalized during the 1 year period. And I think member states are also saying that within the available time we have to finalize, which is good. And if there is commitment, anything is possible. If there is a will, there is a way. So I hope they will do it within the timeline which was already agreed when this process started. Thank you.
I believe Dr. Bruce Aylward also is online. Anything to add, Dr. Aylward?
Thank you very much, Fadela. Can I just confirm, Chris, I can be heard? Great, thank you very much. And no, I think when the Director General has spoken, we've generally covered issues. But I would just, in relation to the most recent question that was asked about whether there's a need, I think you asked Preeti to be buying time for the negotiations at this point. And it relates back a little bit to what Jeremy asked earlier as to whether or not we're at a stalemate in terms of the work on the Accord. And that is definitely not the case, Jeremy. I think the good news coming out of INB5 is that there's been a tremendous amount of work by the member states. Of course, that work is ongoing. They're still in closed committees, so there'll be more information by the end of the day or first thing tomorrow on this. But there's been a full reading through the zero draft, which was the big goal for INB4 and INB5. All member states have had their chance to say their perspectives on different aspects of the Accord, the rationale behind that. And of course, as the Director General highlighted, there's areas of let's say, not full alignment, to put it mildly sometimes on some issues, but a lot of alignment as well. So at this point, it would be really, again, as the Director General said, premature to buy time for the negotiations. Preeti, the reason for that is, as you know better than anyone, is just the importance of getting an accord like this in place. I mean, we've been speaking about multiple other emerging pathogens over the past 30 minutes or so, the Marburg outbreaks and others that are happening. Maria talked a little bit about what's happening with COVID now. And the world is at increasing risk of new pandemics emerging. And I think the everyone would be remiss not to just concentrate minds, efforts, political capital were needed as well to make sure that we do land this accord as rapidly as possible. We owe this not just to future generations, but today's generation. You're going to live there's quite a high risk of living through yet another pandemic. And we want to make sure that we're much, much better prepared for that one than we were for this. And we can't be without an accord like the one under negotiation. So definitely not at stalemate, definitely moving forward. We will be moving, or rather the Bureau, the member states will be moving forward to a first draft. And that's what's important. It's that forward direction and the points that where there's alignment, identifying those where there isn't, and then starting the hard work of further negotiation through those.
Thank you so much. Just for you to have the full title of Dr. Aylward, he's Senior Advisor to the Director General and Assistant Director General at Interim External Relations and Governance. Now, I would like to invite Gabriela Sotomayor to ask the next question.
Thank you very much, Fadela. Thank you, Dr. Tedros. I have a question on the treaty. The treaty looks to the future, but I don't know if in parallel, do you think there should be an exhaustive examination to review what the countries did well and what they did very badly in the management of the COVID? That's the question. And I have a very quick question, if it's possible. Dr. Van Kerkhove spoke about several scenarios regarding the origin of the virus, these animals. But I want to ask if there is a possibility that one of these raccoon dogs could have escaped from the laboratory that is near the market in Wuhan. Thank you.
So perhaps I'll start with the second question first. I mean, the challenge of understanding of how the origins began depends on the information that we have to assess. So understanding where those animals came from as a source within the market is key. We also need to evaluate the labs that were working in the area on coronaviruses and the conditions in which those viruses were worked upon. So there are, again, without information, without data to make a proper assessment, it's very difficult for us to give a concrete answer. And at the present time, we don't have a concrete answer of how the pandemic began, but we have clues. With regards to your first question, I just want to say absolutely, all countries, all institutions, all agencies need to take a look at how they handled the COVID-19 pandemic, and in fact, any epidemic outbreak, and how they managed that, and take a hard look on what went well and what went wrong to make course corrections going forward. We have tools that exist from the World Health Organization. We have these intra-action reviews that are done. And I don't know the exact number, but I think more than 100 intra-action reviews have been conducted on COVID-19. And we're still in the pandemic, by the way, it's not over. But countries have looked at this, and some countries have done multiple intra-action reviews to evaluate where they are, how they have managed, what has gone well and what has not gone well, to make adjustments going forward. And to us, this is a strength. This isn't a pointed finger of pointing blame. This is actually taking a cold, hard look. And everyone made mistakes. Let's be perfectly clear on this. Everyone had accomplishments and had successes, and everyone had mistakes. And even us as an agency, we are constantly looking. There have been several evaluations that have been done of us, which we welcome, which help us to look at how we are doing, what needs to be changed, and again, leading towards this accord, leading towards the future. We have to do better next time. We collectively, as all member states, as all institutions, as all agencies, need to do better. And there are tools that will help us do that.
Thank you. I would like now to invite Emma and then Nina to ask the next question.
And there was one question. Yeah. So on the hypothesis, I think you asked whether it... I answered. You did? Go ahead. Okay. So I think without full access to the information that China has, you cannot say this or that. All hypotheses are on the table. That's WHO's position, and that's why we have been asking China to be cooperative on this. If they would do that, then we will know what happened or how it started. And I said it many times, we need to know the origin of the virus because of two things. One is the science issue, and the second is the moral imperative. Science, because if we know the origin of this virus, then we will know how to prevent the next one or how to manage it quickly. And the second one, the moral issue, many have lost their lives. Almost, how many million now? Close to 7 million, I think 6.8 something million. And this is, even one life is significant. So we need to know that's the moral imperative, because many have lost their lives and many have suffered as a result. So until we know, though, instead of making speculations, our position is to say all hypotheses are open. Okay, some may say, okay, this is more probable than the other, but still that cannot be the answer. We need to know the answer and beyond reasonable doubt. That's when we will say, okay, this is how it happened. So that's not the case. Then on the countries' assessments, many countries have done assessments, by the way, and they have tried to see their challenges and they have tried to see their successes. But the more orderly assessment is coming now with the UHPR. It's the same as the human rights review mechanism. And 4 countries have already done it. More countries are showing interest. This is being piloted. But countries are now using the instrument to see what their capacity is and where the challenges are. But what we expect is, going forward, many countries have learned their lessons. And I think they will respond better in the future. I can take the Mekong region's example. As a region, they have done much better than any other region. The reason behind their success or the way they handle the COVID situation in a better way, the Mekong region countries, is because of the, the muscle memory, their experience with the first SARS. If you take the countries like Vietnam, for instance, Thailand, and they have developed their capacity, and they had that muscle memory because of that experience they had in 2003. So this is almost 19 years before this pandemic started, I think 16 years. So that 16 years, still they had the muscle memory. And I hope the countries have already learned their lessons, and while fighting COVID, they were building their capacity. Doesn't need to wait, even the capacity building, until the pandemic is over. Many countries have been doing some capacity building. And I hope with the continued assessment to learn from this pandemic, I would expect a better capacity. But our focus still should be on the countries who have less resources, who need support. Because unless we support the countries with bigger resources to develop their capacity, as we always say, we are as strong as the weakest link. So that's why we support the pandemic fund, which just started, availed $300 million, and we hope countries will benefit from that. But we believe that financing, the volume especially, should increase. We need more funding for pandemic preparedness and response. Of course, the $300 million to start. We have around 1.3 or 4 billion, I think, to start with, but we will need more. And based on systematic review like the UHPR, I think countries should see where the gaps are and build their capacity as soon as possible. But in addition to UHPR, we're using JEE also, and as Maria said, the after-action reviews and other assessments. Thank you.
Thank you, Dr. Tedros. Emma Farge, Reuters.
Good afternoon. Thanks very much for inviting us here today. I was wondering how concerned you were about the transmission of H5N1 to humans as cases grow in Africa. And were it to jump the species barrier in Africa, how well do you think the response would be? How good would the response be? Thanks.
So I can briefly answer that. We don't have anyone from our global influenza program on, but can answer this in terms of the zoonotic risk. So as you've seen, we have seen an expansion of H5N1 in poultry across the world. We've seen transmission from poultry into mammals. We've seen human cases, so it's always of concern. We have a whole global influenza program. We have an entire laboratory system that has been in existence for 70 plus years, GISRIS, that has a tracking system to be able to study each of these viruses, conduct the genetic sequencing to understand what those changes are and what they mean. As a pathogen that has that zoonotic risk, that spillover risk, the concern is if it has that amplification aspect. And so the entire global community working on influenza are studying these viruses very carefully. They're not just studying, we're not just watching and waiting. I just want to be very clear on that, because I do see a lot of articles that would suggest that people are just watching, but there's an entire scientific community, public health community that is out there working, and we work across our quadripartite with the animal sector, FAO, WOHA, UNEP, to ensure that we have better surveillance on animals and in birds and in mammals, as well as in people. So this is an ongoing regular assessment. The Global Influenza Program publishes a monthly report on influenza circulation, including avian influenza. There are disease outbreak news that are published every day. There was another one published today, which gives an assessment of every situation, every human case that we see of H5N1, and will continue to do so. But it is something that the organization takes very seriously as pathogens that have epidemic and pandemic potential. One of many viruses that WHO is tracking that has epidemic and pandemic potential.
Thank you. Nina Larsen, AFP.
Thank you. Thanks for taking my question and for organizing this. I wanted to come back on Tomo's question about the origins, and I was wondering, I know Maria van Kerkhove, you wrote an editorial in Science today. I was wondering if there's been any reaction from Beijing to that. And also, you indicate there that there's more data available both on the market and on the labs. I was wondering if you could say a little bit more about what specifically you think that data is and what the impact has been, that specific data having been withheld for this long. And sorry, finally, just Dr. Tedros just said that we need clear answers, but I'm wondering if this far after the fact, that's possible with so much data still missing. Thank you.
So we'll let the 3 questions slide, huh? Since so thank you very much for the questions. You know, we as an organization, we've heard us say this many times, we work with all member states, we work with everyone everywhere. Everything that I've said in that particular article that you're mentioning, we've said directly to our counterparts in China. We work with missions here with the embassy. We work with our technical partners. We work with China CDC. There have been several missions to China. As you know, I was part of one of the first ones in February 2020. And so the reason why I suggest that there is additional information is because there is incredible scientists that work in China across the world. There's advanced technologies that are there, and they know what to do. You know, when there is an outbreak that happens associated with a market, the closure of that market is an important step. It's the right thing to do. If you suspect that there is an amplification event or a point source there, closing that market is really important so that you prevent onward cases or further cases. But there's always investigations that happen in that market. And we know that samples were collected. We've seen the data now where that exists. The challenge is that data was collected in January, February 2020, more than 3 years ago. And the reason it needs to be shared is because there needs to be a collaboration of scientists that use different methods, that come together working with scientists in China to assess that, to make an understanding, an analysis, and an interpretation of that. Usually what happens, if there's an outbreak that happens in a market, and I did my PhD work in Cambodia in markets on H5N1, and what you do is you trace those animals back. Where did the animals come from? How were they traded? Under what conditions were they traded? Were they wild animals? Were they domestic animals? What were the species that were sold there? Were they live? Were they slaughtered at the market? And especially when you close a market, where do those animals go? Are the animals slaughtered, or are they actually sold to other markets? Because that could mean if those animals were infected, then they could spread to other markets. So they're clues. It's detective work. And that's really what epidemiology is at the source. And so those studies could have been done. We have asked repeatedly in the March 2021 WHO China joint report. There are recommended studies that are in there. And to this day, we don't know if those studies have been conducted. SAGO published a report in June 2022 outlining studies that need to be done. And to this day, I cannot tell you if those studies have been done. We have had direct conversations with our counterparts of if this information exists. Because it needs to be analyzed. And with regards to the lab, there's lab audit data that can be evaluated and needs to be evaluated. So then, as the Director General has said many times, so that the hypotheses that are on the table can be evaluated and assessed, and either we keep going with them or we're able to take them off. But at the present time, we can't take any of those hypotheses off the table. So there's a lot of information that is out there. We have requested from the United States the reports that they have, where they've made their own assessments. Not only the reports, the latest one from the Department of Energy, but the data underlying those reports. That information also needs to be shared. We made a request for those reports as well. We need the discussion to be had with SAGO amongst experts around the world to make sense of what it actually means. So that's where we're coming from, because we need to do better when this happens again. And one of the things SAGO is also doing is outlining a global framework to study and to outline the studies and investigations that need to take place, everything from environmental samples all the way through better understanding breaches in biosafety and biosecurity, so that every member state understands that when this happens again, these are the expectations, and these are the timings in which these studies need to be done, because it's really critical that we do them at the right time. And your last point is if it's too late, or indicating maybe it's too late. If some of these studies haven't been done, then for some of them, and in particular, studies of the animals in the market, serosurveys, it's too late. But it's possible that those studies have been done, and if they have, we are asking for that information to be reported to us, to be shared with us, so that it could be discussed with SEGO.
Thanks so much. Laurent Siro from ATS.
Yeah, thank you for the briefing. Laurent Siro, Swiss News Agency. In connection with the anniversary, you mentioned the common vision that was shared by the member states in 1948. Do you have the feeling that all the member states share still common vision for the organization today? And I'm not going to ask you about where the organization would be in 75 years, but where would you like to see it, let's say, in 10 years? What achievement should the organization make by this time for the global health? Thank you.
Yeah, thank you. I think on the common vision, I can say that countries can still have a common vision. They had it in 1948, and they can have it again now. Because they had the common vision then with all their divisions and geopolitical rivalries. Maybe when you ask that question, you're bringing that into account, some of the divisions we still see now. But I think they were there then, even it was very, very difficult, and the same now. But still, those differences wouldn't stop them from having a common vision. And since the establishment of WHO in the last 75 years, we have seen when countries, even during the Cold War, to cooperate on health issues. So I would hope the same thing, and there is that hope that I believe can happen again now. And if you take as a common vision, maybe the pandemic treaty or pandemic accord is one. In 10 years from now, I think if we can achieve the SDGs, that would be a big, big achievement. And we have that already. We agreed as global community. And it's a very bold one, by the way. And if we can achieve the SDGs, I think that would be a huge progress for the world. As you know, it was agreed in 2015. The challenge now is, since 2015, I see countries going towards, divergent, the concern that you have also. And there was convergence until 2015. Paris Agreement was agreed then, 2015, SDGs at that time. The Finance for Development, FFD, around that time, 2015 actually. And many other important agreements globally were done during that period. So after that, of course, you can see some divergence, but still, I believe countries will come together to achieve the SDGs, and I think achieving the SDGs and health is part of that. Would be something that we would target and push for as WHO. Thank you.
Thanks so much, Dr. Tedros. I would like to invite Mr. Chen from Xinhua to ask the next question.
Okay, merci. Thank you for giving me the floor. I have a question. Just before the outbreak of the COVID pandemic, we saw military world games taking place. During those games, various American soldiers demonstrated symptoms similar to COVID. Afterwards, and these aren't the only cases, of course, the media reported on the fact that there were similar symptoms to COVID far in advance of the outbreak in Wuhan. And I've noted that there are apparent so-called epidemics of e-cigarettes in the United States. Now, we know that e-cigarettes aren't vectors of epidemics. So, my question, is WHO planning to carry out research at a global level, not just in China? Thank you.
So I could start on this one, and perhaps DG may want to come in. The short answer to that is yes. We have said repeatedly that we will follow the science anywhere that it takes us. The study of the origins of SARS-CoV-2 is a global study, but you have to start where the first cases began. They cannot be done, studies cannot be done at the expense of the studies that need to be done in Wuhan and in China. So the reports that have come out have outlined studies that need to be done in China and elsewhere. And we as an organization have said repeatedly, and will say again, that we will follow the science anywhere it takes us. In preparation of SAGO, in the meetings that SAGO has been having, we have looked, as the Secretariat, we have pulled together all of the information we have from published, from unpublished, from shared results with us of any early indication of SARS-CoV-2 circulation, whether these came from serologic surveys conducted in 2019, whether they came from leftover clinical samples from cancer screening institutes, for example, in Italy, in France, any wastewater studies that have been conducted, and we have followed up each and every one of those avenues, let's say. And in some situations, in the case of Italy, for example, we actually established collaborations where we worked with research groups, 2 separate research groups in Italy, asking them if they would be willing, or if they had any leftover samples, and if they would be willing to share those samples with an independent lab in a different country for verification. So all of that is being followed up. So the 2 examples that you also mentioned are part of the list of things that need to be followed. But again, I just want to be very clear that the studies that have been requested in China have still not been carried out. And we have to understand what has been done with the markets, what has been done in terms of the earliest cases. So if you also remember, there were 76,000 individuals that were potential cases of COVID-19, but they were ruled out. And so there was one of the recommendations was to look at those individuals and say, could any of them have fit the case definition of COVID-19? And if so, if not, fine. And if so, what were their potential exposures? It's all about clues. It's almost like detective work. And I really hesitate to use the word detective because it's taken on a policing tone, but it's what you do. You do one study, and then you find an answer, and then you carry out another one. But all of these questions need to be answered.
Thanks so much. We will take a last question from our friend from Yomiuri. You have the floor.
Thank you for taking my question. I'm Yuichi from Yomiuri newspaper. What are the conditions for lifting a public health emergency of international concern? I asked the same question a few weeks ago, and at that time, Dr. Ryan answered it. However, I believe that it is Dr. Tedros who will make the final decision to lift the emergency. So I'd like to hear Dr. Tedros' thought. And at this point, when do you think the emergency will be lifted? Thank you.
Thank you. I think we will be able to lift it this year. I hope. But the next meeting of the emergency committee is on in a month, I think, because as you know, they meet every 3 months. So it should be early May. There will be a meeting of the emergency committee of COVID. And they will deliberate. And I don't want to preempt that discussion because I want them to really discuss freely. And based on the criteria to recommend whatever they think is, the measures that we need to take, whether we lift or not. So it would be good if we can wait, but as soon as we have that, we will, of course, share it with you. Of course, when the emergency committee recommends, it's a recommendation. then it comes to me whether to agree or not, but 99% we agree because they do proper assessments. The only time probably I may interfere is when there is a tie, and then I can come as a tie breaker. So I would depend on those experts who are really very good and who know what they're doing, and let's see what they come up with next month. Thank you.
This was the last question for today's press conference. Thank you so much all for being here. As usual, we will be sending you the opening remarks of Dr. Tedros plus the audio and video files of this press conference. The transcript will be available on the WHO website tomorrow morning. And you are invited, for journalists who are in the room, to a reception outside the room, invited by Dr. Tedros and colleagues. Over to you, Dr. Tedros, for any final comments.
Thank you, Fadila. Thank you to all members of the press in Geneva who joined us in person. Very glad to have you here with us. And my appreciation also to all members of the press who have joined us online. And see you next time. And to the members who joined virtually, I hope we will see them also in person. Thank you.
And on your way out, T-shirts, happy birthday T-shirts for you. Here on your, as you walk out to the right side, even in different sizes. And only this way you get free